And what we're trying to do is to raise awareness that 80% of us who die from cardiovascular illness, specifically heart attack and stroke, don't have to die. We need to be more willing to ask, are we as fit as we think we are? We need to ask for a well woman visit so we can figure out if we are as well as we are. We need to look at our risk factor profile and see if we have a family member that has heart disease. Is our blood pressure normal, cholesterol in range? Make certain we're nutritionalizing ourselves to prevent heart disease and getting appropriate exercise. Women are caregivers. We take care of our children, we take care of our spouses, and we take care of our parents. And at middle age, we have a lot of responsibility, and we often don't put our own health first. What we have to do is a better job of asking our physician to focus on exactly what our risks are, because we have to think about it. When something happens to us, those folks that we love and care for don't have anyone oftentimes to coordinate their day and their doctor visits and their appointments with their physician. So I'd like for women today to take home the message that when you see someone that's wearing red, or why don't you put on a red outfit yourself and try to remind your fellow woman that we need to take better care of ourselves and that we don't have to die of heart disease. You know, the breast cancer advocates have done a fantastic job. Most women will sit in a gathering and talk about their last mammogram or how it's time to have their mammogram, but you don't ever hear a woman say, this is what my last stress test showed, or this is what I need to have done in the next couple of weeks to check my blood pressure, my cholesterol. We need to make this a topic of conversation so we can prevent unnecessary death from cardiovascular illness in America and women. There is a fantastic test called a coronary calcium score, and that is probably the best test to check the health of our coronary arteries, because it's difficult to have a heart attack without coronary calcium. And this is a test that you don't have to ask your physician to order. You can order this test yourself, and it costs about $69 to $100 out of pocket. Does not require an IV. It doesn't even require that you get undressed part of the time. Just lie down on the CAT scanner, hold your breath 10 seconds, your arteries are photographed, and if there's no coronary calcium, then we're free to focus more on other things like cholesterol, blood pressure, whether or not we're diabetic. But if we do have coronary artery calcium, then we know we need to focus on the risk of myocardial infarction or heart attack. We also need to ask, is our blood pressure to goal 120/70? Is our total serum cholesterol 170? And if we have any weight to lose, don't just be happy with a fasting blood sugar. Ask your physician to do a 2-hour glucose tolerance test, because undiagnosed diabetes is rampant in America and leads to stroke and heart attack unnecessarily.